In this video, I will tell you about the 10 warning signs that you may have vitamin D deficiency. Vitamin D deficiency is a common condition that affects millions of people worldwide. It occurs when the body doesn't have enough of the vitamin D it needs to function properly. This can lead to a variety of health problems, including bone disorders, heart disease, and cancer. Vitamin D plays a crucial role in maintaining overall health and wellness, and it is essential for the proper functioning of the immune system, muscles, and bones. In this video, we will discuss 10 warning signs that you may have a vitamin D deficiency, and the importance of getting your levels checked. Vitamin D is a fat-soluble vitamin that is essential for our bone health, immune function, and overall well-being. The human body can produce vitamin D when the skin is exposed to sunlight, but it can also be obtained through dietary sources. Vitamin D is available in several forms, including D2 and D3, and the question of which form is best to consume has been a topic of research and debate in the scientific community. Research has shown that vitamin D3 is more effective than vitamin D2 in raising and maintaining vitamin D levels in the body. Studies have found that vitamin D3 is more efficiently converted to the active form of vitamin D and is better at raising the levels of vitamin D. Additionally, vitamin D3 is considered to be more potent and effective than D2. Some researchers suggest that vitamin D3 is more bioavailable and has a longer half-life in the body, meaning it stays in the body for a longer period of time, providing prolonged benefits. So, when I'll be speaking about vitamin D in this video, I mean vitamin D3 specifically. Fatigue and tiredness. One of the most common symptoms of deficiency in vitamin D levels is fatigue and tiredness. Vitamin D plays an important role in the body's energy metabolism, and when levels are low, it can cause fatigue and tiredness. This can make it difficult to get through the day and can even lead to depression. The fatigue can be so severe that it may feel like you are suffering from chronic fatigue syndrome. Bone and back pain. Vitamin D is essential for the absorption of calcium, which is necessary for strong bones. When levels are low, it can lead to weak bones and muscle pain, particularly in the back and hips. Osteomalacia, a condition caused by vitamin D deficiency, can cause severe bone pain and muscle weakness, particularly in the hips, thighs, and ribs. Slow wound healing. Vitamin D is needed for the body's immune system to function properly. When levels are low, it can take longer for wounds to heal and can make the person more susceptible to infections. Studies have shown that vitamin D deficiency can lead to an increased risk of infection and slow wound healing. Hair loss. Low vitamin D levels can lead to hair loss, which can be a sign of poor overall health. Vitamin D plays an important role in hair growth, and deficiency can lead to hair thinning and hair loss. Depression. Vitamin D plays a role in the production of serotonin, a neurotransmitter that helps regulate mood. Low levels of vitamin D can lead to depression, anxiety, and other mood disorders. Studies have found that people with depression have lower levels of vitamin D compared to those without depression. Impaired immune function. Vitamin D is critical for the function of the immune system. Low levels of vitamin D can make the person more susceptible to infections, such as colds and flu. Studies have shown that vitamin D deficiency can lead to an increased risk of respiratory infections, including the flu and pneumonia. Insulin resistance. Low levels of vitamin D are associated with insulin resistance, which can lead to diabetes. Vitamin D helps regulate the levels of our blood sugar, and deficiency can lead to an increased risk of developing diabetes. Muscle weakness. Vitamin D is essential for muscle function, so when levels are low, it can lead to muscle weakness and difficulty moving around. Increased risk of falls. Low levels of vitamin D can lead to weak bones, which can increase the risk of falls and fractures. Studies have shown that vitamin D deficiency is associated with an increased risk of falls and fractures in older adults. Dark skin. Dark-skinned people have more melanin in their skin, which can make it more difficult for the body to produce vitamin D when exposed to sunlight. This can increase the risk of vitamin D deficiency. Melanin is a pigment that protects the skin from the sun's harmful UV rays, but it also reduces the skin's ability to produce vitamin D. This means that people with darker skin are more likely to be deficient in vitamin D and may require additional sources of the vitamin, such as supplements or fortified foods. Diagnosis and treatment. If you have any of these symptoms, it does not necessarily mean that you have a vitamin D deficiency. However, if you do have any of these symptoms and are concerned about your vitamin D levels, it is best to speak with a healthcare professional and get your levels checked. The most accurate way to diagnose a vitamin D deficiency is through a blood test called 25-hydroxyvitamin D test. A level of less than 20 nanograms per milliliter is considered a deficiency, and levels between 21 to 29 nanograms per milliliter indicate an insufficient level. If a deficiency is found, treatment will usually involve taking a vitamin D supplement and increasing your exposure to sunlight. The recommended daily allowance for vitamin D varies depending on your age and other factors, but for adults, it's generally recommended to take about 600 to 800 international units per day. In my opinion, the general recommendations tend to be quite low, and personally, as a 183-pound male, I take 4,000 international units per day. However, everyone should test their own vitamin D levels and consult your doctor to find the best daily intake for you. Also, people with a deficiency may require higher doses to bring their levels back to normal. In addition to supplements, increasing your dietary intake of vitamin D-rich foods can also help to prevent and treat a deficiency. Some good sources of vitamin D include fatty fish such as salmon, tuna, and mackerel. Egg yolks and mushrooms are also great sources of vitamin D. How vitamin D should be taken. Vitamin D3 is a fat-soluble vitamin, which means that it is best absorbed when taken with a source of fat. Taking vitamin D3 in a capsule containing oil can help to increase the absorption and bioavailability of the vitamin. The oil in the capsule can also help to protect the vitamin D3 from being broken down in the stomach or destroyed by stomach acid. Research has shown that vitamin D3 is more effectively absorbed when taken with a fatty meal or when taken in a capsule containing oil. The oil can also help to increase the shelf life of the vitamin D3, as it is less likely to degrade when stored in an oil-based capsule. It's important to note that not all oil-based capsules are created equal, and it's important to choose one that contains a high-quality oil such as olive oil, fish oil, or MCT oil. It's also important to check the label of the capsule to make sure that the vitamin D3 is in its natural form and not synthetic form, as this can affect the effectiveness of the supplement. In conclusion, taking vitamin D3 in a capsule containing oil can be an effective way to increase absorption and bioavailability of the vitamin. Summary. In summary, vitamin D deficiency is a common condition that can lead to a variety of health problems. By being aware of the warning signs, you can take steps to protect your health and avoid serious complications. If you suspect you may have a deficiency, it is important to speak with a healthcare professional to get your levels checked and determine the best course of treatment. Remember that a combination of diet, sun exposure, and supplements are the best ways to keep the vitamin D levels in check. I hope this video gave you a better understanding of the markers you should be aware of in order to notice early on the first symptoms of vitamin D deficiency. If you have any questions at all, please feel free to comment.